Hello there, and welcome. Thank you so very much for being on time to your appointment today. It's great to see you. Let me just check in with you. How have you been feeling overall lately? Okay, I understand. Well, in that case, let's go ahead and begin our physical examination right away. Starting with your optic nerve. I have a Snellen chart right behind me. And if you could you please go ahead and read the smallest line possible with both of your eyes? Yes, whichever line is the smallest line for you, please go ahead and read that to me. Okay. Thank you. What I'm going to ask you to do now is continue that same exercise, but I'm going to cover one of your eyes. So, can you please go ahead and read the smallest line on the Snellen chart that you possibly can read? Okay. Go ahead. Read the line that's smallest. Okay. Good. Very well done. Continuing on with this side now. Go ahead and read whatever line is the smallest line that you can read while still seeing the chart. Okay. Okay. Very good. Great work. Good to see that despite the faraway distance of the chart, you're still able to accommodate and visualize. Very happy to see that. And continuing on with the eyes, I'm going to begin with a pen light. And I just need you to tell me if you can see this pen light through this blue colored paddle. It's moving in a vertical motion. Okay. And can you see it going horizontally through the blue paddle? Okay. And can you please tell me what color paddle you see now? Can you visualize the light going vertically through the paddle? What about horizontally through the paddle? Can you see it still? Okay. And what color do you see before you in 3, 2, 1? Okay. Can you vertically see the light? Okay. And can you horizontally see the light? Okay. At once, can you see the light transfer through all 3 paddles before you? Tell me which color paddle the light stops moving at. Okay. And continue with your optic nerve just for a few quick more assessments. I need to ensure that there is proper movement and proper working order for the optic nerve, ensuring that the dilation process is working accordingly. Focus on my light and what shape am I drawing? What shape am I drawing? And good, okay. Switching eyes at this time, making sure everything's working order, and tell me what shape you see that I am drawing. Tell me what shape you see that I am drawing. And go ahead and tell me what shape you see. Okay, very nice. Happy to see that the optic nerve is in working order. Do you notice any sensitivity or dryness at all? I don't notice any redness in your eyes, which is a good thing, which can occur when you are experiencing dry eye. But as long as you're feeling comfortable, everything's looking good for me. Good. Okay. Very nice. Now your last little check of the optic nerve. Can you please follow the pen light to my fingers? Okay, any difficulties at all? Okay, good. So look at this light and just tell me when you no longer see it in your peripherals. Okay. Okay. Right there. Right there. Okay, right there. Good, right there. Right there. Right about there, you said right there. Okay, right there. And then other side. Okay, good. Okay, good. And you said right about there. Right around there. Okay. Okay. Right there. Right there. Right there. Right. Okay. 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 Excellent. Okay. Moving on to your facial nerve and the olfactory nerve at this time. I'm going to begin by just gently feeling around the face. This is just so I can see if there's any swelling of the glands or the sinuses. Sinusitis is very common around this time of the seasons. So, if at any point you're noticing some pressure that's discomfortable, painful, unnerving, let me know. A little pressure on both sides of your skull. Okay, under the jaw. Okay. Good. Okay. Just release any of that tension in your face. Let it all droop down and Give me a neutral kind of look on your face. Give me a big smile with your teeth. Give me a frown. Can you scrunch your eyebrows together? Can you raise your eyebrows up? Okay, very good. Can you go ahead and stick out your tongue for me? Okay, keep it there just for a moment. And can you go, Okay. Great work. Put your tongue away. And now, let's go ahead and see how the facial muscles react. Please shut your eyes, close your eyes, and I'm going to describe to you the tool I will be using for your face. It is a tool that has a soft plastic end and then a brush that is a bristle-like texture on the other side. Please tell me which you are feeling on your skin in 3, 2, 1. Very nice. Keep your eyes shut. 3, 2, 1. What do you feel on your face? Okay. Very good. 3, 2, 1. 3, 2, 1. 3, 2, 1. 3, 2, 1. Okay. Facial muscle reacting just accordingly how I'd like it to do. And continuing on with just one more facial reflex test. For our next facial nerve examination, you may go ahead and shut your eyes if you'd like. I'm going to use a little bit of room temperature water on your face. I just want you to tell me which side of the face you're feeling this on in 3, 2, 1. Just patting it into the skin. Okay. Where do you feel it now? Okay. 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 And where do you feel it now? Yes, that's your forehead. Very nice. Now continuing with your eyes shut. Where do you feel this? And then, where do you feel the mist? Okay, now just want you to stay nice and still and rapid fire. And you felt all of those sensations all throughout your face. Okay, good. Very nice. I'm glad to hear that you're not misting a thing according to my examinations. And I'd like to move on to the olfactory nerve and finish up working on the facial muscles and anything going on up here. So, please go ahead and tell me what scent is in this little vial right here. counting it forward. And your answer in 3, 2, 1. Okay, very good. Go ahead and continue that with another scent. And please, on the count of 3, go ahead and tell me what you're smelling. 3, 2, 1. Okay. Excellent. Once more, we'll be completing our olfactory nerve test. Go ahead and inhale. And what scent is that? Okay. You are looking excellent in terms of your facial muscles, your olfactory nerve, and the optic nerve. Let's continue on with your hearing, okay? With your eyes remaining shut, please go ahead and listen for the sounds I'm about to produce in your ears. And please tell me what side you hear the sound on. It could be one side, both sides, the middle. Let me know. Keeping your eyes shut, just listening. I'm paying attention to you and focusing on your reactions. Okay, I do have the most excellent sound to test your hearing with, so please, with those eyes shut, listen for this egg shaker. Okay, and do you hear it on the same side or a different side? Keep your eyes shut. Is this in the left, center, or the right? 3, 2, 1. Left, center, or right? 3, 2, 1. 3, 2, 1. Left, center, or right? Okay. Last examination is going to be a quick vitals check. I need to ensure that your reflexes are working accordingly. So please hang your arms just loosely at the side. I'm just going to come onto this side of you and gently the mallet against your pressure points that will cause you to have your reflex. 3, 2, 1. 3, 2, 1. For your legs, same exact exercise, just leave them tingling as they are. 3, 2, 1. 3, 2, 1. Okay. I saw all the reflexes working accordingly and properly. Thank you for being a good sport. And take a listen on your lungs, your breathing, and your heart. And then you are all set, my dear. Are you feeling okay? Okay. So in that case, just give me a few deep breaths for me. Sorry if this is cold to the touch. 3, 2, 1. Deep belly breaths. Okay. Deep belly breaths. Okay. And then you can just return your breathing back to a normal pattern. Don't think on it. Just listening in. Okay. I'm gonna come around the back side of you. And okay. 3, 2. Just breathing for me. Nice, simple, soft breaths. Simple, soft breathing. Good. Okay. I'm gonna listen to your heart rate now. I'm gonna go ahead and pull up a timer on my watch. So, on your mark, get set, and we are listening into that heart. Okay. And great work, steady, and okay. You are resting at a nice 75 beats per minute. Excellent. I'm very happy with the results of your physical examination. Are there any concerns or anything that you think I should know regarding medical history, anything that we need to update, discuss, or anything you'd like to bring to my attention at this time? Okay, well, if anything changes, feel free to phone the office. One of the nurses can get back to you. If not, I can also give you a call back if there's any further questions. So, thank you very much for coming to get your physical exam today. It was a pleasure serving you, and I hope that you stay healthy, take care of yourself, wash your hands, and let's be careful out there, okay? Yes. Thank you. Bye-bye. Hello there, and thank you for being here. How are you at this time? Very good. Thank you for asking. It is your annual cranial nerve examination. I'd like to ask, how's your health been overall since I've last seen you? Okay, that's very good to hear. At this examination, we're going to test the functions and how well you're able to comprehend any suggestions I might be putting out there. Do you remember the major cranial nerves that we're working on today? Off the top of your head? No, it's okay. I'm only teasing. We have the olfactory nerve, the facial nerve, the auditory nerve, ocular motor as well. Are you feeling well? May I begin the examination? Okay. First thing is first, you might already see the Snellen chart behind me. I would like for you to read the lines as best as you can and as many as you can, starting with both eyes. So please take a moment, go ahead and pay attention to all the lines you can read. Very good. Okay. And if it starts to get difficult or a little too blurry, just let me know and we will go ahead and just switch. Okay, very nice. the eyes at this time, starting over here, and just as best as you can, read as many lines as you can, as best as you can. I'm trying my best to hold still as well. Okay, very good. Good. Are any of them too difficult? Okay. Okay. Very nice. Over here now. Same exercise. Please, as best you can, read these lines. If they get too blurry, just say the word. Okay. Very nice. So it seems that you're able to comprehend pretty significantly down the Snellen chart. Love to see that. Please take a moment to look directly at my nose. Okay? Don't peek anywhere else, just stay nice and still. Getting a little close. Okay. Keep paying attention right here. Excellent. Okay. Continue to look right at my face. Gently covering up this eye. Okay. You can see the light. Okay. You can still see the light. Perfect. Can you no longer see it? Tell me when it comes into your view. Okay. Very nice. Can you see the light? Okay. Tell me when the light is no longer in your view. Okay. Tell me when it's in your view again. Okay. Great work. Same as before. Just 2 fingers this time. Okay. Okay, right there. Okay, right there. Right there. Right there. Right there. Okay. You're doing a very great job. I need to dim one of the lights. Stay nice and still. And I'm gonna get close. Just take a little bit of a look. Just keep looking. Focus behind my shoulder. No distractions. No need to look anywhere else. Okay. Down. Okay, now please follow the light down. Okay, follow it up to the side, to the other side. Same as before. Up, down, side, side, up, down, side, side, up, down, side, side. Very good. Okay. Look directly at me. Okay. Look directly at me. Okay. The pupil dilation is reacting with an exact speed that I'd like. I'm noticing that your peripheral vision is very similar to where it was last year, if not the same. Great work. Did you have any sensitivity or discomfort with the light? Did you have anything you noticed that you want to bring to my attention? Yes, that's a great point. As long as you've been using your glasses and making sure you are staying off the screens excessively, using compresses on your eyes, you should feel very soothed and no longer having tired eyes. Yes. Good. Okay. You're Wonderful. In that case, now that they've had a moment, we're just going to switch the Snellen chart, continue checking the distance, comprehension, and then we have one more check on the optic nerve, okay? This chart behind us has several different images and graphics depicted. I'm going to point to several of these, and I would just like for you to identify the shape or object, okay? What shape is this? What shape is this? Okay. Can you see this one? Okay. What's the smallest line you can see? Okay. And what is this right here? And does this shape match this shape? Wonderful. If you were to wear this pair of lenses, can you see clearer through these? Or are you able to see a little clearer through these lenses? This is for you to determine. Only you know the answer. This is a test that is not one size fits all. It is customary to your needs. Okay, so the clear is a little clearer. Okay, let's confirm that. Can you see this? Okay, but it's not the best. Okay, that's fair. Okay, thank you. So, it does not look like you've had many changes in the optic nerve. Not seeing any negative results. Continuing on with the facial nerve at this time. Could you please tell me if this is a dull sensation or a sharp sensation on the face? Okay, go ahead and shut the eyes. Or just look right behind, beyond me. Okay, tell me if this is sharp or dull. Okay, sharp or dull. Sharp or dull. Sharp or dull. Okay, good. Just keep going. Just no longer telling you. Just keep going. Okay. Where do you feel this tool on your face? Okay. 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 Good. Good. Excellent work. To continue with the facial nerve, can you please give me a huge, big smile? Could you please give me a frown? Okay. Can you raise your eyebrows? Are you one of those people who can raise one eyebrow? I'm not. Good. Now, can you please open your mouth and stick out your tongue? Say, Okay, one more moment. Okay, good, good. Okay. Now, open your mouth and can you wiggle that tongue back and forth, left to right? Okay, up and down. Okay. Great work. So, looks facial nerve, optic nerve are working condition in order. Check your sense of hearing at this time. And to do that, I'm going to need you to shut your eyes from this point onward. I do not need you to keep your eyes open if you need to shut them, okay? Yes. So I'm going to come to one ear or the other, and I just need you to tell me where you hear me, okay? So, what side do you hear this sound on? Yes. Let's begin. What side do you hear this sound on? Okay. And where do you hear it now? Is that the same side? What about now? Okay. Continuing on, where do you hear this sound now? Okay. And let's see. How many times do you hear this sound on one ear? Okay. How many times do you hear it? Okay. And how many times do you hear it in total at this point? Okay. Great work. Hearing is looking well. Whispering some numbers into your ears at this point. And can you please tell me what you hear? 7, 2, 6, 4. Okay. 3, 9, 8, 10. Wonderful. Looks like the auditory nerve is reacting wonderfully as well. I'm going to check a few reflexes. So, nice and still. Just need to see your arm nice and straight, flat out. No pressure, no tension. We're just going to see other reflexes. 3, 2. Okay. Other side, 3, 2. Okay, we can do that one again. That was a little 3, 2. There we go. Legs straight out, bend at the knees. Ready? 3, 2. Okay. 3, 2. Okay. You feeling well at this point? Okay. Check your sense of smell at this time. Now, just need to ask you what this reminds you of, what this is the closest to, just as best you can, please. Okay. That smells like, on 3, 2, 1. Okay. Looking good, feeling good. At this point, are there any questions, concerns that you'd like to bring to my attention? Of course. I think for you, getting routine cranial nerve exams is important for your health, and making sure that you are routinely repeating them, looping them, liking them, and enjoying your experience with them. Yes. I have no further concerns today. I think for you, like I said, the best thing you can do is continue to maintain routine scheduled appointments. Okay. I'm very glad we discussed that today. Any further questions, comments, concerns? Okay. Well, at that point then, the nurse is able to check you out of this appointment to go over any further documents you might need to sign, okay? Okay. Take care of yourself. Be kind to yourself. Drink lots of water, okay? Yes. Okay. I'll see you later. Bye. Good. Give your eyes a break and just dimming the light. Okay. Same exercise. Look at the fingertip. You're not necessarily experiencing dryness under the eyes. Okay. What color do you see? What color do you see? Shut your eyes. Hello there and welcome. It's nice to see you again. I'm Dr. Caitlin. How have you been doing lately? Okay. Are there any recent concerns or questions you'd like to bring to my attention? Sure. If there's anything that comes up, please let me know. But for now, I'm just going to start our examination with your eyes. Please let me know. How have your eyes been feeling lately? Okay. All in all, you would say that you're not necessarily experiencing dryness, irritation. Okay. I'm not noticing any redness of concern. Very good to see. Now, I'm going to test your eyes. Is this a letter, a number, or a shape? Good. What am I holding up right here? Okay. And now, I'm going to move back a bit. You stay right where you are. What is this symbol that I'm holding up? Okay. And is this a letter? Okay. And is this a number? Okay. Now, just covering this side of your eyes up, I want you to go ahead and tell me what letter this is. Okay. Continuing to cover that side of your face up. What's this shape right here? Okay, very great work. Covering this side now. Can you please tell me what I'm holding up? Good. Excellent. And now, please reset your eyes for me. What am I holding up right here? Very great work. Okay. Now I want you to look at my fingertips. Good. Follow. Good. Your eyes are reacting to the movements. Nice to see. Now keep looking at the fingertip. Okay. Keep focusing right there at the fingertip. Okay. Good. Give your eyes a break and just dimming the light. Okay. Same exercise. Look at the fingertip. Okay. Very good. Keep it up, keep it up. Excellent work. And reset your eyes. We're just going to turn the lights back up to where they normally were. Good work, okay. Just give your eyes a moment. It might be a little bright. You may need to adjust, that's okay. So, I'll feel around your face and your eyes. Just checking. any sensitivities. At any point you feel discomfortable, irritated, inflammation, pain, please let me know. Okay, very nice. And I'm just going to apply a little pressure right around the temples, under the eyes. Okay. So your olfactory nerve is feeling very healthy. Glands are very activated. Oil and tear ducts are excellent conditions. Definitely seeing reactions. Love to see it. Now, testing your colors, your sense of color, and how well you can identify colors. What color is this in front of me? Okay. And now, please tell me what color you see in front of you. Okay. Is this the same color? Okay. Now I'm going to show you another color. Remember this color? Is this color the same color as this color? Okay. Is that original color the same color as this color? Okay. Great. Now you see this color right here, yellow. Okay. Is it a similar color to this one? Is it a similar color to this one? Is it a similar color to this one? Okay, you're doing so well. Just a few more tries, covering this side up. What color do you see? What color do you see? And what color do you have in front of you? Moving it back and resetting your eyes. What color do you see? Okay. Now, we're going to continue on the other side. What color do you see? What color do you see? What color do you see? Okay, great job. Continuing on with our colors. What color do you have in front of you? Okay. Do you classify this as a warm color or a cool toned color? Okay, great. Now, what color is this? Would you classify this as cool? Okay. Now follow the cool shade of blue. Good. Now, when I change the color again, I want you to tell me what you're seeing now. Yes, very good. So this is just a bit of a neutral color, a bit of a neutral reset. It's light. And we are going to follow it over here. Follow it out. And 3, 2, 1. Turn it off. 3, 2, 1. Turn it on. And would you classify this as a warm color or a cool color? Okay, very good. How would you spell this color? R-E-D. Excellent, okay. Now, what color do you think is coming next? No wrong answers here. Just take a guess. Wild guess, wild guess. This is not part of the exam. Okay, it's part of your intuition. Let's tap into it. What color do you think is coming next? 3, 2, 1. Okay. Now can you follow the cube across horizontally to my finger? Vertically to my finger. Diagonally across. Okay, excellent work. And we're just going to continue with one more shade. What color is this right here? Okay. Follow this one in a circle. Follow this one in a square. Triangle. And last but not least, just for you, a heart. Great work. Very great stuff. Let's continue our exam with feeling some of your nerves and how their reactions are. So this is just a little brush with a bristle at the top and a dull, soft end. Please tell me when you feel the dull end on your face. Okay, very good. You can go ahead and close your eyes. Just feel for the movement on your skin. Great work. And you don't have to shut your eyes if you don't want to, it's optional. It's a bit of a bonus if you're feeling tired at all throughout the exam. Now the bristle side. Tell me when you feel it on your cheekbone. Okay, excellent work. So you are having some reactions. You're noticing every movement. Excellent, that's exactly what I want to hear. Now, speaking of hearing, we will be checking your ears momentarily, but before we do that, I just need to check that you can feel this mister on your face. So 3, 2, 1. You're going to feel some cool water in your face. Other side. Does that feel good? Okay. Now, just let me know when you can no longer feel it. Okay, let me know when you can feel it again. Okay, other side, same exercise. Tell me when you feel it and then you no longer feel it. Excellent, very great work. So, facial nerve is reacting quite well to all of our exams so far. Next part, favorite part of the exam. Big smile with your teeth for me. Okay, now give me a frown, a pout. Okay, good. Now, your next exercise is just puff up your cheeks for me. Good, big puffed up, I love to see it. Raise your eyebrows up for me. Okay, this is not part of the exam. Another bonus little side test. Can you raise just one eyebrow? I can't, no. Nope, not in my jeans, I cannot. But can you? Okay, good. So, now I just need you to scrunch your face for me. Okay, great. And next, I'm just going to press on your shoulders. I want you to shrug your shoulders upward. Good. And then opposite, I want you to push your shoulders down. Good. Okay. And then I want you to resist me. Grip onto you. And I want you to hold me back. Perfect. Good. You're doing great. And release. Good. Excellent. So I'm just checking your muscles and their strength and making sure that those nerves are responding and you're not feeling any discomfort. Taking some quick measurements. These are just to ensure that everything is healthy, that you're in good working shape. I'm going to do some quick. Good, so I'm not noticing any symmetry that seems to be off. There's no bumps or indicators, cuts, nothing of discomfort on your scalp, on your face, on your neck or chest that I'm seeing everything is symmetrical. We look for symmetry to just ensure that there's nothing going on elsewhere, no growths. Good, I'm glad you understand. So, to trick your hearing, nice and simple, I'm just going to come over to one side. Just tell me when you feel my gloves. Hear my gloves. Good. Shut your eyes and tell me what side you hear my gloves on. If you hear them at the same time, just tell me. Continuing on with your ears, we're going to use our spoolie brush again, and we're just going to gently press this against your ears. Let me know when you hear it. Okay, and then we're going to switch ears. Let me know when you hear it on that side. Excellent work. Now our next hearing examination is quite a quiet one, so I need you to have your listening ears open for me, okay? Shut your eyes, and I have a miniature bubble timer. It is filled with liquid, and you're going to hear that liquid in just a moment on one side, and we're going to switch, moving around. Just please let me know which ear you hear it on, okay? Starting now. Very good. Continuing on to the other side. Good. It's a very subtle sound, but you can pick it up. Good. That's what I want you to hear. Subtlety. Nothing too overbearing. Where is it now? Okay, good. And one last check on the either side. Where do you hear it? And then one last check on the other side. Where do you hear it? Great work. Excellent. You can open your eyes. It's quite the cute little timer. I'm glad you like it. So I'm very happy to report that all of the examinations that we put you through today are in no way a waste of your time because you passed every examination. Yes, you did. Very proud of you. Keep it up. Your health is in great shape, great condition, and it is so good to see you. So I hope you are not a stranger, but I sort of hope you are, if you know what I mean. Alright, take care and be well. Let's be careful out there. Bye-bye.
How many times would you say that you've had a cranial nerve examination before? Okay. How many times would you say you've had a cranial nerve examination with your eyes completely shut? Okay. Well, today we have an innovative new cranial nerve examination for you to experience. My name is Dr. Caitlin. I'm going to assist through this new procedure. If you've ever had a cranial nerve exam before, the only differences are I'm not going to test you where you need your eyes open at all. So what I recommend is looking right at my face. Okay. Blink. Blink. And go ahead and blink to close those eyes. Okay. First checks are going to begin with testing light. Tell me if you see the light. Okay. Tell me if you see the light. Am I going horizontal or am I going vertical? Okay. still see it? Okay. Yes, I'm glad to hear that. The optic nerve's looking great on that eye. I'm going to block that eye that we just used and test the other side. So, am I going up and down with this light? Am I going side to side with this light? Do you see the light getting closer? Do you see the light going out of your view? Do you still see it? Okay. Very nice. With your eyes still closed, I'm going to ask you to tell me where your blind spot is. Tell me when you no longer see the light. It is currently right in front of your face. And I'm going to pull it to my right, your left. Tell me when you no longer see it. Okay, so this is sort of right around where you're starting to lose the peripheral. Okay, that's very normal. I'm going to realign it in the center, and we're going to move to your right, my left. Now, 3, 2, 1. And just tell me where the light starts to get out of view for you, where we lose your peripheral vision. So right around there. Okay. That is a very normal location on both sides. It's quick. I'm going to check once again. Can you tell me when you no longer see it? Okay. Okay. Very good so far. Happy to tell you that the optic nerve is looking very, very great. I do have to check it with a few more tests. So, I'm going to hold up a color, and I just need you to identify this color. Okay. Okay. Can you spell this color out for me? It's 5 letters. Okay, that is correct. Very good. Very good. So, I'm going to pull another color up for you. What color is now in front of your face? Okay. How do you spell this color? Yes, that's 4 letters, correct. Okay. And then, what color am I putting in front of your face now? Okay. This is a 3-letter word. How would you spell this? That's correct. Let's continue that exercise. Except I'm not going to say anything. I'm just going to have you tell me what color you see in front of you. Okay. Okay. Very nice. Okay. Now, similarly, I'm going to draw shapes, numbers, letters, etc. So, what color am I drawing this shape with? And what shape did I draw? Correct. What shape am I drawing and what color am I using? Yes. And let's see. What's the color and what's the shape? What's the color and what's the shape? Great work. Next, I need to check your ears. The optic nerve looked great. We're going to move on to the auditory nerve at this time. These hearing checks are just going to include me looking in the ears while also giving you some instructions, okay? I'm gonna look into the ears and I just need you to tell me what numbers you hear me repeating, okay? Okay. Take a peek in that ear and just tell me what numbers you hear me whispering in this ear. 2, 3, 4. Okay. What numbers was that? Check this side out, and I'm going to ask you to repeat the numbers back to me. 5, 4, 3. Okay. Good news, when I'm looking in the ears, I'm not seeing any redness. There's no tenderness, and you don't have any built-up fats concerning. Everything looks healthy, but let's continue repeating numbers for me. 6, 7, 8. Okay. 10, 11, 12. Okay. And now I'm going to stand kind of in the middle of your face and your head. I'm just going to speak directly at you. Use both those ears and just tell me what numbers you hear. 6, 5, 1. Okay. 11, 15, 18. Okay. 20, 17, 9. Excellent. Just to make sure that you're hearing everything okay. I'm going to use some water. I'm just going to kind of drip it near your ears. Just tell me when you hear it. Okay. Good. It's important that you can make out these subtle sounds. We just want to make sure that when we check the cranial nerves that we thoroughly make sure all areas are examined in full detail. And especially since I have your eyes shut, you're more susceptible to just relax and follow along. So keep up the good work and good. Okay. The ears are looking very good. I'm going to just do one last test. I'm going to put my hands in the middle and just tell me when you hear it go from the middle to a particular ear, okay? Right in the middle and okay. Okay. Excellent, okay. Awesome work so far. Auditory and optic nerve are looking great. I do need to check your olfactory nerve super quick, so I have a few different little scents for you to smell from. We'll start with the first scent. And I just need you to tell me, what do you think this smell is under your nose? Okay, great guess, thank you. I have two other vials we're going to use. Shaking this one up a little bit. And what do you smell in front of your nose? Okay, great guess. And then let's check the final little vial that I have here. Shake this one up a little as well, make sure everything's all nice and mixed. 3, 2, 1. What smell are you picking up on? That's correct. Okay. So the optic, olfactory, and auditory nerves are looking wonderful. I'm going to be testing various nerves on the body at this time, including touching your face, around your head, okay? Okay, I won't go anywhere below the shoulder line, just arms and legs, okay? Perfect. So, we're going to start with a tool that is a typical metal mallet. And you might have seen these at the doctor's before. It's when these on your knees, to check your reflexes. But on the bottom of that, there's this soft sort of metal. And it has a bit of a point. I'm just going to lightly touch you with the soft or the pointed end. So just tell me sharp or dull, okay? Good. Ready? Okay. So now that you understand the sensation you will be feeling, I'm going to kind of switch between sharp and dull. Ready? You're doing an awesome job. Ready? Okay, and great. Just keep those eyes of yours shut while I go on and do another check with a pom-pom or a dull little wooden point, almost like a toothpick, but instead of it being sharp, it's dull. Okay, so sharp or dull, which one do you feel on your face? Okay, keep it up. Keep focusing on the sensation on your face. when I say hot or cold, I should say my body temperature from my gloves or this water cool sensation. Not hot or cold in that sense. Ready? I also need to check a few other things with your face. With those eyes shut for me, can you please smile with your teeth? Okay. Shut your mouth. And can you please smile with no teeth? Okay. Relax. And you can give me a frown. Okay. Now, can you puff up your cheeks like you're taking a big puff of air? Good. Now, can you please suck in your cheeks like you're just letting that go? Like you had something sour. Very good. Can you raise your eyebrows for me? Okay. Very nice. And can you scrunch your whole face up for me really tight? Release. Can you scrunch your face up? Not so tight, but just a little. Very good. Okay, relax your face. Good. Nice and still. I'm going to check the symmetry of your face at this point. And any symmetry on your head, neck, and scalp. Very nice. So stay still right there. And can you just press your shoulders lightly up for me? Let your shoulders go. Press them up. Let them go. Press them up. Good. Keep doing that 5 more times. Okay. That's great. I'm going to need you to loosely put out your arms at the side and tell me when you feel me using the reflex mallet, okay? 3, 2, 1. Okay. 3, 2, 1. Okay, and both knees and legs just dangling loosely. Okay. 3, 2, 1. Okay. fast asleep, so don't force it. Let it come naturally. Can you take a big breath in for me? Good. Okay. Natural rhythmic breath. Okay. Breathe in a little deeper. And a little deeper. Okay, good. Release. Breathe in. And a little deeper. Release. Okay. Take a listen to your heart. 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, you're very relaxed. You're sitting at 64 beats per minute. Very nice. You feel okay after the examination? I'm glad to hear that. A lot of clients experience anxiety at the doctors, but these closed eye examinations help me and they help you. And I'm happy to report that the cranial nerve examination went off without any hitches. So, you're good. I am happy to report that all those nerves are in working, functioning, perfect order. Yes. Thank you for coming in, and I hope to see you again soon. Hopefully those nerves stay in place this time. Okay. Well, you take care, and bye-bye.
Before we begin your cranial nerve examination, I just need to ask, how are you feeling at this moment? I understand. Well, you're in good hands. I'm Dr. Caitlin, and I'm here today to perform a cranial nerve exam for you. Have you previously experienced a cranial nerve exam? It consists of several various nerves, including the olfactory, auditory, facial, ocular, motor, and optical nerve, just to name a few. We will begin with your optic nerve then. I need you to please look right at my nose. Right here. Keep your focus on me. I'll move around. Just keep that head still. And that focus here. Right here. Okay. Very nice. Could you please follow this light while I cover an eye? And I'm just making sure that your reflexes are working accordingly. Okay, switching eyes now. And feel free to blink and blink to help rest those eyes. Another side now. How is this light feeling on your eyes? Okay then, well, in that case, let's do a few more checks. Using a bit of a brighter light, I want you to follow it with both of your eyes. Okay, horizontally now. please look right past my shoulder. I'm going to take a look into that eye right there. Just blink once or twice to refresh your eyes. And look past my shoulder on this side. Just try to relax. So, what you're saying is that there is light sensitivity throughout all these triggers and tests. Interesting. I'd like to examine your eyes a little further. How about you look at this hand right here? Okay? Watch it move across. While I do these sorts of triggers and tests, you're not feeling sensitivity or strain. Okay. So it appears to be just when a light source is involved. Okay, very good to know. Can you please watch my fingers? And tell me when you to ask you to tell me what color I'm pointing to on this little slug. So, what color is this right here? Correct. And then which color am I pointing to? Right here. Okay. Look at the slug and what color is this? Correct. A little further back now. Color is this. Correct. And last, which color is this? Correct. Excellent work. Happy to report that any signs of colorblindness are not showing up in initial testing. But let's do some more charts, and then we'll rest your eyes for the remainder of the exam, okay? So, I need for you to please read for me lines number 1, 2, and 3. Okay, yes. 1, 2, and 3, perfect. Okay, and now in line number 4, how many letters do you count in that row? Okay, now in this row right here, how many letters do you count? Yes. And now, what's the smallest line that you could read to me today? Just go ahead and read that line for me. Okay. Perfect. Correct. I ask that you shut your eyes now, since you've noticed discomfort throughout the exam, and we might have a pinpoint to what's causing these cranial nerves to be awry. So just keep those eyes shut for the rest of your exam. The rest of our tests will be physical touch, hearing, or smell based. Okay. Good. Please, can you identify what is in this vial? Is a scent I need you to identify. Do you know what this some symmetry. Dimensionally, we're looking well. The facial nerve is very important to examine. Tilt your head up. Perfect. Just stay like that once more. Just stay once more and longer. Okay. Very nice. So just gonna get close. Nice and still. Just gonna come around a little closer, and then just around a little more. Okay, 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 okay. Just take that off of you now. Just need to listen to some quick vitals. So, just need you to breathe in for me. Big, deep breath in. Just keep breathing for me. Okay. Now, just a little bit more controlled breathing. Big inhale. And hold it. Release. One more of those. Big inhale. Hold it at the top and release. Perfect. Last check is just going to be your heart. So, nice and relaxed, rhythmic, normal breathing, back to normal, ready, set. 2, 3, 5, 10. Very good. You're sitting at 71 beats per minute. Very healthy, loud sounding heart. So last but not least, I am happy to report that you are looking okay. However, those eyes of yours, you did experience discomfort with some light testings. I am going to need to order a few further exams regarding the optical nerve, considering that they are still bothering you, but please feel free to keep them shut as long as you need to, okay? It's not a big deal if they're bothering you. We can accommodate you. Just let them shut and relax, okay? I'll leave you to it. Take care and bye-bye. Make sure that you're nice and comfortable, and we will begin your physical examination. Prior to the exam, could you confirm your full name and your date of birth? Okay. Before beginning, is there any new medical information that you'd like to share with us, or any recent medication changes? Okay. Is there anything that you want to speak with me about prior to beginning the exam? Sure. Not a problem. If anything should come up during the examination that you want to discuss, just feel free to let me know, okay? Stay nice and still. I'm going to start with the face. Going to feel around the face. Should you notice pain or sensitivity at any point, please stop me so we can address the underlying issue. Okay. Just tapping the surface, the cheeks, the nose, around the jaw. Okay, let's lean in and take a look at your glands. Is it pressing? What are you feeling? How would you describe the pressure that I'm applying to your glands? Okay. Check there. When you experience cold and flu season or allergies, how do your glands typically react? Okay. I ask because some patients, they experience more swelling, and that's sort of their telltale sign that they're getting sick. Or in your case, you start to notice a little bit of a twinge or a little discomfort there, and you notice that the glands are swollen. I see. Okay. Okay. Alright. Let's now check the scalp and see what you've got going on. Up top. Most importantly, I'm looking for any physical disturbances on the body. So, whether there's a deformity, such as a bump, or if there's something growing or just feeling around. Do you notice any discomfort throughout your head, your neck, and scalp? Okay. Okay. So what you're expressing is you tend to feel just a normal amount of discomfort in your neck and shoulders. Okay, good to know. Thank you very much for letting me know. Going to now test some facial reactions. Okay? So, tell me when you feel my finger. Okay. Very good. So, I want you to close your eyes now. And when you feel my finger touch you, just let me know. Now, when you feel the cool sensation of air on your face, please let me know, and just let me know what cheek I'm applying that sensation to. You ready? Okay, so you feel that just fine. Okay, now let's do it to the other side. Let me know when you feel this on your cheek. Okay, good. So you can feel that just fine. Okay. Now, could you please raise up your eyebrows for me? Okay. Can you please blink rapidly for me? Rapid blinks. Perfect. Now, can you give me a smile? Yeah, wonderful. Can you give me a frown? Okay. Now, can you scrunch your face as tight as you can? Don't hurt yourself. Just tight. Okay? And just release it. Wonderful. Let me feel around your jaw just a bit. Can you clench and bite down? Okay. Just keep that clench. Keep that clenching. How's that feel on your cheeks, right around the bone area? Does that feel okay? Okay, you can release the clench. Just keep your mouth right where it is, and I'm gonna peek inside. Okay. Yes, I'm seeing very healthy, cared for mouth and the throat. Just stick your tongue out for me. Very good. Not gonna be here too long. Don't freak out. Just stay still, nice and still. Good. Okay. And up. Perfect. Keep your face right where I have you, and I'm just gonna look in the nostrils. I'm just gonna take a peek up in the nostrils. Okay. Alright. Other side. Do you have allergies, or do you experience anything similar to seasonal allergies? Okay, let me take a look in your ears then. We'll see how those are looking too, because especially during allergy season, you tend to have a bit of buildup in the ears and the nose and the throat. That's pretty visible. So we're just gonna peek inside. Okay. 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 So far, everything's looking wonderful in the sinus tract, and we're not noticing physical discomfort when I press on the sinus tract, and your facial muscles are reacting accordingly. Keep up the hard work. Let's adjust your eyes a little bit now. Can you look at this light for me? Okay,
Just track it with your eyes as best to your ability. As best to your ability. Okay. Keep looking at me. Just look at my nose for a moment. And now, nice and still, I'm going to cover up one side. And I want you to track the pen as best as you can. Just watching the movement and the motions of your eyes, ensuring that dilation is according to the time that I want it to react, checking that you're able to comprehend the words that I'm saying. Now, let's switch. Feel free to blink a few moments if you'd like to reset your eyes. In the meantime, I'm going to pop this right here. Just have you follow as best as you can follow. Faster now, checking the dilation. All right. How are you feeling? Okay. I'm glad that your eyes are doing a-okay. We're going to keep going with a few more tests. We're going to see how the tear duct of the eye reacts to a little bit of air. Now it's just going to be a quick poof, poof of air. On this side we start. Ready? Set. Okay. The tear duct's reacting, okay? It's gonna keep an eye on that. Good. Other side. Let me know when you are ready. We'll pump the air in 3, 2, 1. Okay. So, just blink a few times. Feel free to use some cotton that I have. We can wipe your eyes for you. There we go. So the tear ducts are reacting as well. Just how we want them to. What color is this that I'm holding up? Okay. What color is this that I'm holding up? Okay. Is this the same color that I just showed you? Have I shown you this color before? What color is this? Okay. And what color is this? Point to the green. Okay. Point to the green. Okay. Point to the yellow. Very good. Last little bit. Can you point to the green? Can you point to the yellow? Okay. What's this color right here? Great work. Your eyes are looking sharp. Now we're going to do a Snellen chart test. Don't you fear, that Snellen chart is just for display. So, we're going to start with one eye, any eye of your choosing, then the other. And then we'll end the eye examination portion with both being utilized. So let's start here. Can you just read the first 3 lines for me? So it starts at the very, very tippity top, the very, very tippity top. Okay? Very good. Keep it up, keep it up. Good job. Okay?
Now starting at line 2, 2, 3, and 4 for me, please. Is that a little closer? Okay, we just want to play with the effect of your eyes and how you can see. So 2, 3, 4 for me, please. Okay, now give your eyes a quick little solid blink, and let's have you read as many lines as you can. So I'm just going to hold it up right here for you. Just as many lines as you can. Okay. Okay. Very good. What about this? You're doing a great job. Congratulations. So now that I have tested everything going on in the cranium, we're going to come back to the ears in a little bit. But for now, we're going to move on to the rest of the body. I'm going to apply pressure and various amounts of tapping, like so, onto various muscles, various parts of the arms, the neck, the back, the shoulders, the chest, and torso. Okay? Start with the neck. Just gonna tap around here. Just around the back of the neck. If you feel tightness, please stop to let me know. But for now, all the physical tension I'm feeling is very normal. Your shoulders are feeling okay. So they're not too uncomfortable. Would you say that they're discomfortable? Okay. Going to go in a straight line down the back of your spine. Ready? Does the spine feel okay? Okay. Okay. Let's go down the arm, just gently. You can just let it lay at your side. Perfect, just like that. Okay. Other side, just let it be dormant, relaxed. Okay. We're going to check some reflexes now on your arms. Just want you to loosely have your arm dangling off to the side like you just did. And I'm just going to lightly see if there's any reaction. Hopefully your arms reflect. So on the count of 3, just nice and still, relaxed, limp. 1, 2, 3. 1, 2, 3. And now I want you to relax this arm over to the side as well. Just 1, 2, 3. 1, 2, 3. And ready? Next time. 3, 2, 1. Very good. Just keep your knees nice and loose for me. We're going to do the same thing. 1, 2, 3. 1, 2, 3. Very nice. So you do seem to be reacting and having reflexes. Very much so what we want to have happen to your physical response. We love it. going to take a listen in to your breathing and your heart. Do you have any concerns regarding any asthma treatments or any asthma that you may have? Okay, I will be sure to keep that in mind throughout the exam. So why don't you just do a few deep breaths for me? I'm going to listen to your heart. Okay. Yeah, that's sounding perfect. Okay. Wonderful. I want you to now stay nice and still. I'm just going to place this around the heart. Around the collar right here, and listen in. I guess it is the heart space. Move it down. Okay, a little on the belly now. I know it's always a little chilly once it gets to the belly, but you're doing a great job. Keep up the hard work. Good. Let that exhale go, and I'm going to step around and check out the back body now. So we're going to place this on the back of your, kind of like your shoulder blade area. Ready? And I just want you to breathe normally for me. Very good. Okay. I'm going to move it down onto sort of the lower, upper lower back. Just big deep breaths right now. Big deep breaths. Okay. Your lungs and your breathing sound excellent. I know I asked previously, do you have any concerns with allergies this allergy season? Okay. I didn't notice any difficulty when you were breathing. I didn't notice any strain on your lungs. There was no wheezing or anything like that. And when I checked your throat and glands, everything looked clear. Your nose and your ears as well didn't have any debris or buildup that can occur when you are experiencing allergies at a moderate to severe level. So keep up the hard work on the allergy front. Lastly, I just need to look inside your ears once again, just do a few final tests, and you'll be all set for the day. So, I'm just going to start on this side, nice and close. I'm just going to feel the ear. I'm going to tug. What do you notice? Okay, sure, that's normal. And then over here, let's check this side. Okay, I'm gonna tug a little. How does that feel? Okay, wonderful. Just gonna check your ears and your hearing now. Okay. So you can hear this note perfectly fine? Okay. Shut your eyes and tell me what side that I'm on, please. Okay. You're doing excellent. Thank you so much for following along. We're almost complete, and how's that? Good. You can open your eyes whenever you're ready. And we're just gonna quickly recap a few things. Were there any questions, comments, concerns, anything that you'd wish to discuss further with me at this time? Sure thing. Well, if anything changes, you can feel free to call the office. One of the nurses or myself will get back to you with a detailed response. In the meantime, your physical examination went wonderfully. Everything is in working order. So let's just start with the facial nerves. Everything in your face was reacting wonderfully. I didn't notice any buildup, any pressure, pain, discomfort, anything like that in the sinus tract or when I pressed on your glands. So you're nice and healthy in that regard. When I checked the scalp and the ears, once again, everything was looking healthy. Keep up the hard work on the ear cleaning. Just make sure that those ears stay nice and clean. Your eyes, the color tests, the light tracking, and everything was wonderful. The reactions were all perfect. And when I listened to your lungs and your breathing, as I said, everything just passed with flying colors, 10 out of 10 on the health scale. Anything else before we wrap up? Yeah, I will, and you as well. Thank you so much for being here, and I'll see you again soon. Thank you so much for meeting with me today. Especially after the holidays, it's incredibly important for us to focus on our body's health. We tend to put our body through a lot during the holiday season, whether it be stress that we are consuming or that be physically getting sick, worn down, feverish. All of those things are very normal after Thanksgiving. So in order to stay healthy, to ensure that your immune system is at its strongest, it is so important that you visit a holistic doctor to fulfill those stressful places of your life with good energy, with healing medicine. We're starting with a peppermint essential oil spray, just in the air for some aromatherapy. I think this smell is so lovely, and I hope you like it too, Greg. Just need to get a little info about your Thanksgiving. So, what did you do on Thanksgiving? That's fun. Of course. And how many people were you with? Okay. So right now, we're going to focus on boosting that immune system. So that way, you stay nice and healthy, since you were just around a lot of people. And then, what did you eat that weekend? Okay, so the usual. Was it yummy? Good. Okay. Were you eating desserts? What about drinks? Did you have any alcohol? Okay. Is there anything else that you consumed that I should know about? Maybe you had some of Aunt Biddy's favorite pie, and she might have spiked the punch, something along those lines. Okay. Nope, just a standard Thanksgiving, Greg. Okay, good. Well, in that case, we're going to get a little more info on you for your best treatment plan. Let's start by taking your temperature. So, just going to spritz this down with some alcohol, and we're just going to wipe it. Okay. And we're just going to place this under your tongue for 10, 9, you sound okay? Just gonna start by listening to your heart, and then you and I will do some deep breathing together. So, just nice and still. Just gonna get my timer going. Okay, I'm just going to start your timer, and I'm just going to listen. Okay. So, you're very relaxed right now. Your heart rate is steady. You're at like a 72 beats per minute. Very steady heart rate, calm. You're not nervous or anything? That's good to hear. So, Craig, let's get into that deep breathing at this time. We're going to calm your body down and bring it into a relaxed state. When you're in this relaxed state, we're going to perform a few more exams. I'm going to let you rest, and I'll come back with some drinks that you will try, and hopefully they will suit your needs and clear out your gut and help with that gut health. There's millions of live bacteria growing in our guts, and especially after Thanksgiving, with all the gluttonous consumption that we go through, we can cause some disruptions. We can cause flare-ups, gastrointestinal issues, and we don't want any of that. So we're just going to give you some good guidance today, okay? Okay, let's relax you, Greg. Just get you calmed down. You're gonna take a big breath in for me. You're gonna hold it. 5, 4, 3, 2, 1. Exhale. Inhale, Greg, for 5, 4, 3, 2, 1. Let it go. Okay. Big inhale for
citrus. Just going to make sure that the whole beverage diffuses properly before serving it. It's almost fully dissolved. And when this finalizes, we're going to slowly drink over the next few minutes to allow your gut to heal. This is infused with probiotics, live cultures, millions of bacteria that heal. Okay, so you're just going to sip, take a, and then, okay, just like gurgle, slurp. It's not rude to slurp here, okay? You're just gonna, as you take it, you're just going to sip that for the next few minutes. These are, as I've said, anti-inflammatory. And if you find yourself needing more of these treatments over the next couple of weeks before Christmas or Hanukkah or whatever holiday you participate in, we're definitely able to accommodate more treatments to better your gut health and ensure that you are on the right track to feeling healthy and to having good gut health for this holiday season. Alright, Greg, as you finish up your appointment today, all of these drinks will be available. Alright, Greg. Alright, Greg, these beverages and medical treatments are available for you to bring home with you today. You also can feel free to spend a little time here at the Wellness Center. The Wellness Center is designed for anybody, patients, to come together and enjoy, decompress, become one with nature and their space. That way you can have confidence in your treatment and enjoy our beautiful property. How does that sound? Good. I will leave you to it. I'll give you a few moments to pack up your belongings and you can feel free to explore the gardens, or you can go into our indoor lounge and just relax as you enjoy your medicine. Hello there. Just here to check on you this hour. I'm your nurse, Caitlin. I'm so sorry if I woke you. Are you sleeping? Okay. Well, I will be quick with you.
my nose, please. Okay. Okay. Good. Can you please tell me where your blind spot's located? Just when you don't see the light anymore. Okay. Okay. a lot better now that you've had some eye drops in them. How are you feeling overall since I came in here? On a scale of 1 to 10. Okay. Glad to hear that you're doing a little better. I brought you a new pillow for the night. Just gonna give you that part in my reach. It's a nice soft pillow for your head. Just gonna remove your other pillow, place this here. Nice and still for me. Okay. I'm just gonna fluff it a little bit. I'm sorry I got your blanket in your face. Is that better? Okay, fluffing your pillow now. Does that feel okay? Yeah. Is it too soft? Is it too firm? Okay. Alright. Let's just adjust your blanket a little bit to make sure you're nice and tucked in. Okay. We're gonna make sure we get a nice night's rest. So, I hope you can fall back asleep. And I hope that you are feeling better. It's really nice to meet you tonight. I'll let you get some sleep. Good night. Turn your light off. Before we begin on your cranial nerve examination, could you confirm your full name and your date of birth? Got that, okay. Excellent. Thank you. So it appears that you need to get your cranial nerves tested yet again. It's interesting how they always seem to get out of sorts, huh? Yes, okay. Well, we will test and see what's going on with you. See if we can find a treatment plan for these wacky nerves that you've got going on. If you feel any discomfort or irregularity while I'm touching your face and around your ears, just let me know. I'm going to go through your scalp. Look for any bumps, any potential areas of laceration. So, just checking out. Everything looks good so far. Look around you. Side the sensation though across your skin? Okay. 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 Tell me when you feel my glove, and then tell me when you feel the mallet, okay? Make sure your eyes are shut. Yes. Just let me know which sensation you feel on your facial nerves. Okay. So far, so good. You can open your eyes whenever you feel comfortable doing so. Means I'm gonna take a look at them. Can you just please look beyond my shoulder at the Snellen chart? Just stare straight back. Yep, just right beyond my shoulder. Right over there. Okay, look right there. Keep looking. Good. Keep looking over here. I'm gonna kind of block it, so if you want to look over here, you can too. Whichever side works best. Just as long as you're staring off somewhere at the distance. Okay. Okay. Very good. How did your eyes feel when they were staring? Did you notice strain or discomfort? Okay. Any concerns? Okay. In that case, why don't you follow my pen light a little bit, please? Okay. Okay. Look here where the pen is. Look here. 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 Good. Look here. Look here. Good. Look here. Look here. Look here. Okay. Okay. Very good. Okay. Look at the light. Look at my fingers. Look at my fingers. Don't look at the light, please. Look at my fingers. Don't look at the light. Okay. Very good. Very good indeed. Your eyes are being all right. Now, if I could drift your attention to the Snellen chart behind me, we're going to read a few lines. I do recognize that it's far away, so we'll be doing a few variations. So, please look. Can you read the first line? Second line. Third line. Starting here. Perfect. Fourth line. Okay. Very good. What's the smallest line that you can read on our Snellen chart behind us? Yep, whichever one is the smallest one, just go ahead and pick that line out and just follow along with the numbers, the letters. Thank you. Okay, that's excellent work. Now, I'm going to test you with a smaller Snellen chart. And same practice, we're just going to have you read various lines that I call out. Can you read the first line for me? That first letter at the top. The second letter and the third letter, please. Good. Can you read for me the fourth row? Okay. Okay. Very good. Good.
row, please. Fourth row, please. Fifth row, please. Very good. Okay. Any questions regarding this chart? Okay. I'm just going to draw your attention back to the Snellen charts. If you could please drift your attention to the chart behind me and just follow along with the various shapes and indicate what they are, please. So this at the top. Okay. This right here. Okay. Right here. Okay. Right here. Okay. Right here. Very good. Okay. Let's do whatever row is the smallest that you can make out. Please read it to me from start to finish. Okay. Whichever one that is. Okay. Okay. Very good. Okay. Eyes are looking wonderful. Last little round of tests for the eyes. Okay. What color is this? Okay. Tell me what color these both are. What are these four colors? Okay. Is this color the same color as this color? Okay. Is this color the same color as this color? Okay. Are these two colors the same? Different? Are they in the same family? How would you categorize these two colors? Okay. Very, very good. Your eyes look great, and we're just going to continue with just a handful more tests on your eyes. So look at my fingers. Just follow them out. Testing to see what your blind spot is and where the visual ends. Perfect. Okay. Good. Look here. Look here. Look here. Look here. Look here. Look at the pen. Okay. Look at the pen, please. Look at the fingers. Look at the pen. Look here. Look here. Look here. Good. Look here. Look. Look here. Look here. Look at the pen. Good. Please look at the pen light, which is brighter. And follow that light as I follow your eyes. Whichever light appears to be brighter. Okay. I'm watching your eyes to ensure you're following along properly and that they're reacting well. Okay. Follow the dimmer light, whichever light is dimmer. Okay. Okay. Perfect. Very good. You're doing great. Doing a great job at following along. And perfect. Pleased to say your eyes are looking great. We're going to test your hearing a little bit now. So, I'm just going to come close to you and just repeat back to me what you hear. 5, 10, 3, 2, 1. 17, 29, 35, 16, 2. Okay, and now I'm going to tell you some other things. I just want you to repeat them back to me.
Yes, you passed all those wonderfully. I'm going to use my tuning fork in the tune of C on your ears now. Tell me when you hear the sound coming closer and when it goes away. Very good. Ready? I want you to shut your eyes. And now I want you to hold up every hand of the ear that I'm on, okay? Excellent, okay. Perfect, stay nice and still. You can open your eyes. Good. I'm actually going to make you close your eyes again. I'm going to have you tell me what side I am using my gloves on, okay? So you're just going to hear me get close to one of your ears. I just want you to tell me what side you hear my glove on. Big eyes shut. Okay. This is just another way for me to feel around your ears, but also test to see how well they're working auditorily. Good, okay. Head straight. Give me a smile. Give me a frown. Crunch your brows. Raise them up. Eyes over here. Eyes over here. Eyes over here. Eyes over here. Eyes right here. 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 Rapid fire. Excellent. Okay. Can you inhale for me? Exhale. Okay, good. I'm just watching your chest. Okay. Open nice and wide. Swallow. Good. Stick your tongue out. Okay, wiggle it side to side. Over here. Over here. Wiggle it up. Wiggle it down. Excellent. Okay. Facial nerve is looking perfect as well. So, I have a few other tests that I'm going to run by you. Let's start with the sense of smell. If you could, make sure you're just shift your focus somewhere else. Don't want you to read the label on my spray. Give us a waft, please. Okay. Okay. Perfect. That is rosemary. Excellent. No peeking. No peeking. This one is a little strong. I figured you would know that one right away. Okay. Ready, set. Peppermint, correct. Alright. One more smell for you. Make sure those eyes stay shut. No looking, no peeking. I know that your eyes work well, so I don't want you using them. Okay. Here we go. Okay. And you know what this one is? Okay. Ready? Citrus, that's correct. Yes, that is citrus. So, let's see. Your facial nerves are looking wonderful. And we do need to check some of the reflexes a little further. Your face was great. We're going to check your shoulders and then your arms. So, do please resist my touch as best you can. And then try to resist me pressing down on your shoulders like so. And just feel me pressing down. I want you to just press back. Good. Good. Okay. Okay. Feel your lymph nodes. Feel your jaw. Okay. Do you have any problems when you open your mouth, unhinging it, clenching it? Do you notice any tightness in it? Okay. I can make a note of that. Good to know. Can you please relax your arm down to its side like so? Wonderful. On the count of 3, I'm just going to lightly get your arm. 1, 2, 3. Okay. 1, 2, 3. Last one. 1, 2, 3. Other side. Relax your arm down to the side. Let go. Good. 1, 2, 3. 1, 2, 3. 1, 2, 3. Perfect. So, good news is your cranial nerves are looking back in order. They might have just been a little disrupted due to either irregular brain activity. It could be something developing. It could just be from head trauma, whatever it might be. I am happy to report that you are looking okay. I'm just going to take a listen in on your breathing very quickly. Just want you to inhale for me and just exhale. Just let your breathing return to normal. Let your breathing return to normal. Okay? Okay. I'm going to come around your back. And if you can just, nice and slow, just going to put on your lower back. Breathe normally in. Out. In. Out. Good, okay. Let's come out of that. How do you feel? Good. Happy to report your cranial nerves are in working order. You're looking in tip-top shape. So I hope to see you again when you are feeling better. And I hope that you got some answers to your questions.